Rhythms of the Heart. Welcome to SBH Bronx Health Talk, produced by SBH Health System and broadcast from St. Barnabas Hospital in the Bronx. I'm Stephen Clark. Heart rhythm problems, or arrhythmias, occur when the electrical impulses that coordinate your heartbeats don't work properly. This can cause your heart to beat too fast, too slow, or in an irregular fashion. A fluttering or racing heart may be harmless, or it may affect your lifestyle, or it may be life-threatening. With us today to discuss heart arrhythmias is Dr. Salim Baghdadi, an electrophysiologist at SBH Health System. Welcome, Dr. Baghdadi.
Good morning, welcome everyone.
So let's start out in layman's terms. When we talk about heart rhythms, what are we talking about?
We're talking about the way the heart beat. Usually the heartbeat in normal fashion. I usually describe it to my patient like a rhythm. You hear the rhythm going in regular time expected. So any time there is any abnormal rhythm, that called arrhythmia. So arrhythmia is not normal rhythm, not the way the heart beat. And the arrhythmia the heartbeat could be described as fast, as low, and sometimes it could be normal range of heart rate, but could be abnormal beating. So all this considered like arrhythmia, and this is what I specialize in this treatment of those arrhythmia.
Okay, so what is the normal heartbeat at rest?
So normal heartbeat, what the doctor would call it, is a big term, normal size rhythm, between 60 to 100 beats per minute. What does that mean? That means the heart is beating regularly at a rate like 60 beat to 100 beat per minute. That the rate usually varies on the situation the person is. So if a patient is sleeping, relaxing, as a person sleeping or relaxing, it could be hard, it could be about 50, 40, that's normal, even though that's considered abnormal in other situation. However, if a person is excited, happy, or exercising, the heart could be about 100 beats per minute. And depending on the situation, that considered normal or abnormal. A lot of time I get people calling me, my heart is 110, 120, I'm worried. Well, when I asked him, what are you doing? He said, I was climbing the stairs, I was running to see a friend, and that's normal way of being 120 beats per minute. As a matter of fact, there's a formula that calculates the maximum heart rate of the person. Usually it's 220 minus the age. That's why people go to the gym and they give you a heart rate when you go on the elliptical or treadmills. Usually applying this, you have to put your age in and they give you the normal heart rate. So it's all depend on the situation. However, as a person sitting watching TV and they're very relaxed, all of a sudden the heart rate goes to 120, 150, that's abnormal. So it's all situational, okay. But between 40 to, I would say between 50 to 100 are considered normal range.
Okay. Now, as an electrophysiologist, where do you fit in the equation? Now, if you're concerned about your rate of your heart rate, you go to your primary care physician. They would refer you to a cardiologist, right? And then the cardiologist would refer them to you. Is that how it typically works?
Correct. So usually, whenever we suspect any arrhythmia, the first thing people should see is to seek medical attention. Depending on the level they are. A lot of people, they feel abnormal, they go straight to the emergency room because they're worried, especially if something has to do with the heart. Some people who feel comfortable, they can wait it out, they go to their primary care doctor. And some people that they know about my field, they come straight to me or go to cardiology. What's really important thing of management is seeking medical attention. It doesn't matter where. Is it a hospital or urgent care center or primary care doctor? Most doctors, when they hear about that, the first thing they would do, they would take a detailed history about the symptoms and they do EKG. EKG is very simple test that I think most people had it done part of their life, which is just putting electrode and measuring the heartbeat. And that test gives us a lot of information about the heart rhythm. And based on that, if it's normal, usually for primary care doctor or heart will reassure the patient and tell them, oh, everything is okay, you don't need to worry about it. Or if it's abnormal, then they will refer it to the either cardiologist, either straight to me, based on the rhythm, based on the heart rate and symptoms.
Okay, so typically, are more people likely to go for a physical exam and then find out they have an irregular heartbeat, or do they have symptoms typically?
Okay, typically, when any symptoms usually have some symptom, any abnormal arrhythmia. Let's say any arrhythmia a person has, it has its symptoms. Depending on the person who's looking for it. Some people, the arrhythmia is so fast, it happens very fast, and they feel sudden change, they will seek medical attention. Some arrhythmia is not that bad, and probably a lot of people, they have it for a while before going to the doctor and doing an EKG or something, realize something abnormal with their heart rhythm, and that's how get figured out. And when you go back and ask him, did you feel short of breath when you walk? He said, yeah, doc, the last year and a half, I didn't feel myself, but I attribute it because I'm getting old or something like that. So I believe all arrhythmia has symptoms. People, the way perceive them is vary from person to person. But usually we picked up a lot of arrhythmia based on just routine screening for EKG. A lot of time people go for surgery, they need to have an EKG. As long as they have abnormal EKGs, they come to us.
Okay. What are some of the common signs? I mean, you talk about shortness of breath. What else may you have that would indicate?
Okay, the most common arrhythmia. Okay, so anything related to the heart could be attributed to arrhythmia. So the most common presentation that people come to me for either palpitation, they feel like have a skipped heartbeat or feel the heart racing, that for fast heartbeat. Sometimes they feel dizzy, or sometimes even fainting or passing out. They get referred to me, and then we do the testing to find out what it is. There's a lot of symptoms that could explain arrhythmia. For example, chest pain. You mentioned in the introduction, fluttering of the heart, a fluttering sensation, short of breath when they walk, dizziness, passing out, all this considered. So any symptomal exertion or short breath, any symptom that relate to the heart could be explained by arrhythmia. We do tend to rule out the most common causes of those symptoms. Usually most common cause of coronary artery disease, as for layman term, is the blocked artery. But most of the time it could be not it, could be arrhythmia, and that's how we treat it.
Okay. Now, some of the terms that I've heard of before, just so if we can explain it, tachycardia or bradycardia. What do those terms mean?
Okay, so doctor used big words just to sound smart, but technically tachycardia mean heart, and tachy mean fast. I'm not a Latin expert, but I think the origin may be in Latin. So fast heartbeat. Brady means slow, and cardia is heart, so it means slow heart, slow heartbeat. So usually terms that people of the trade, they use it, the doctor use it to explain to us a person what it is. So sometimes, as I mentioned, some tachycardia are very normal, what we call a sinus tachycardia, and there's something bradycardia, we call sinus bradycardia, depend on the context of it. So you can have an athlete who exercise 5 days a week, or a professional athlete with heart rate of 40, even 30s, which is considered to normal person. A person who have a heart rate of 30, they're feeling very bad short breath. They may pass out with this heart rate. Meanwhile, a basketball player or a runner, heart rate of 30, that's normal for them. So the term itself doesn't mean they have a disease. Right. It means describing how the heart is doing. So bradycardia and tachycardia could be normal, could be abnormal.
Okay, and another term that is familiar, I think, out there is AFib, or atrial fibrillation. Explain that if you could.
Okay, so most of the AFib actually is a very common disease. It's estimated that people who about in the 80s, they have a 20% population has this rhythm, and it's a very common disease. We see it in young people, we see it in old people. Technically, atrial fibrillation means the heart beating irregularly. So as I say, the heart beat in rhythm, like a normal rhythm on time. However, in atrial fibrillation, where regular heartbeat beat irregular. That's the way when we listen to a heart, we describe it a lot of time. You see, and you look at doctor notes, it says irregular rhythm. That's mean suggestive of atrial fibrillation. Atrial fibrillation, as I say, very common disease. It's very important to know about it because beside the symptomatic of it, as I mentioned before, the palpitation, the dizziness, the shorter breath when they walk, the tired and the fatigue, it's also a high risk for stroke. So a lot of time, the way we treat the disease, we treat the symptom, and we want to prevent the stroke, which is a very simple thing to do by taking a blood thinner that we give it to our patient. Almost every person who has this irregular heartbeat get a blood thinner, technically to prevent them from having a stroke. And plus, we try to treat them for their symptoms.
Okay. Now, ventricular fibrillation is like a widowmaker, right? That's deadly, correct?
Ventricular fibrillation is one of the worst arrhythmia that a person can have, and usually it has to be dealt with it right away, and usually it's deadly. However, our technology, we can identify the patient that are high risk for it, and we do have a treatment to prevent people from dying suddenly. There's something sudden cardiac death. A lot of people, you hear about that, they were okay, all of a sudden they passed away. And usually the cause of death, most people attribute it to heart attack, maybe the initial cause, but most people that the way they die suddenly it's from arrhythmia. And that arrhythmia called one of them ventricular fibrillation, when the heart technically is not pumping blood. And if as you know, it's not blood, it's not oxygenated blood, not going to the if not going to the body, people will die. So that treatment usually is defibrillator. If you've seen in movies, when they take two pads and they shock the person to bring him back to life, that's the treatment. So we do over here at Barnabas for people who have high risk of ventricular fibrillation. And those people come in two varieties. The most common variety for people who have a weak heart. And we know those people who have a weak heart, they tend to have ventricular arrhythmia. So we do give them a defibrillator after we give them treatment. And for those people who survived sudden cardiac death, people who we know they had ventricular fibrillation and were resuscitated either in the field or in the hospital, they get the defibrillator because the minute they have one episode, the chance of having second episode is very high. If we do save. Actually, I can mention a lot of patients of mine, a story that actually started. Actually, I started working on Barnabas in 2016 when I saw a young person who was sleeping. His wife next to him noticed that he's breathing abnormally. So she called EMS, and she called the 911. 911 told her to do CPR. He wasn't responsive. They did CPR. When the rhythm was ventricular fibrillation, he was shocked. He came to the hospital. Actually, he had a very long hospital course. He stayed for 10 days. He needed to have a breathing tube. That's one permanent breathing tube. They have to take it out. And finally, when he got better, he's like 36 years old. I met the family. I met this. And we ended up giving him a defibrillator. The reason I'm bringing the story, so most people who have those devices, they follow up with us on a regular basis, and all of a sudden, on one regular follow-up 2 years later, the wife come to me. He said, remember when he first time had this disease? He was breathing the same way at night, and all of a sudden, he went back to normal breathing. When we checked his defibrillator, he did have another episode of ventricular fibrillation that saved his life. So we do have something that really help our patient to save life. Now he's a working person. You can see him selling clams on Arthur Avenue. And he every time, like the family, he has 2 kids. Like we see with that, we're able to save his life once and twice. And hopefully he lived to see his kids grow up.
Yeah. That's a great story. It leads me to the next question. Are there certain medical conditions that make you more susceptible to an arrhythmia like this?
Okay, so usually what we call coronary disease is the most common disease that happens in our population. Usually what we call it a blocked artery. People who have a blocked artery, they have a arrhythmia. What happens is a piece of the heart, when we have blocked artery, the heart doesn't get enough blood to the heart. The minute you have an area when it doesn't get enough supply, doesn't get enough oxygen, makes it arrhythmogenic. What does that mean? Make it prone to arrhythmia. And those most of the time that common. The other cause is usually hypertension. Usually if people drink alcohol a lot, cocaine cause it, weak heart, for whatever reason, could be viral infection, could be what we call, sometimes unfortunately we see it, what we call postpartum cardiomyopathy, when people have birth and they have a weak heart. All this can cause to put them on a high risk of having these arrhythmias, fatal arrhythmia. Usually what we do when we find out about it, if they did not have a fatal arrhythmia, they only have a risk for it, we try to treat them with medicine and we see if that work. A lot of people who have a weak heart, when you treat them, like even though they have high blood pressure and cause the heart to be weak, then we control the blood pressure and the blood pressure improves, the heart function get better, and they don't need any further treatment. People who have blocked artery and the heart is weak because of that, we treat the block, we open the blockage, and people get the blood flow back, and the heart gets stronger. It doesn't work. It doesn't need to go any further treatment. It doesn't need any further devices or another thing. However, sometimes some people do need it who don't get improved in medical management. Then we move ahead and give them to protect them one device. The other treatment that usually used for those arrhythmias, there's certain arrhythmias that people have, especially young people, called SVT. A lot of times people call SVT, which is acronym for big word, supraventricular tachycardia. What does that mean? Abnormal fast rhythm, abnormal fast beat. And sometimes the treatment, usually the medication does not help very well. We do have a treatment called ablation, which are procedures that we do that if a person has this type of arrhythmia, usually they have an extra wiring of the heart. And with small procedure, usually most of the time is the ambulatory procedures. They come in one day to the hospital with a small catheter, we'll be able to get rid of it, and they live. Usually the arrhythmia doesn't come back, and they do very well. So we do
one-shot deal. Ablation is a one-shot deal typically.
Yeah, ablation technically is. What does that mean? I just want to bring it up because this is another way of treating arrhythmia. Ablation means that taking a small catheter, a small wire. If you see a small tube that we threaded through the groin, through a vein to the heart, and on the tip of the heart of this, there's the radio frequency a source that heat up the tissue. When it heat up the tissue, it make it unable to form arrhythmia, and that's why how we treat the people who have a fast heartbeat. And again, it's usually those people very symptomatic. They feel the heart going very fast. They feel dizzy. They feel very anxious. And the minute you get rid of it, they go back to their normal life as it never happened. That's one of the treatment that we do offer for those arrhythmia.
Right. And I guess even before you get to the treatments, there are a battery of tests that you run as part of your studies, right?
Correct. Of course. We do usually, it's a treatment, usually any disease that you get to, doesn't matter where it is, heart disease, kidney disease, lung disease, you need to make the diagnosis. And the 90% of treatment, I think, you have to make the diagnosis right before you approach a treatment. And when you make the diagnosis right, the treatment is very easy, the best thing to do it. So to help us make diagnosis, usually the symptoms, the history is very important. The recurrence of the symptoms, the physical exam sometimes is very good. And as I said, the most valuable test that we do, which is an electrocardiogram, an ECG, which can be obtained anywhere, and that's going to tell us a lot. And then we do use, sometimes we need to make sure that the heart function is okay. We do ultrasound, which is a very safe test. Blood work also gets done. And sometimes for people who with certain arrhythmias, they may need to have a stress test or cardiac catheterization. So this is usually the test that we usually do. And it's all available here in our hospital. We can get it done within very fast to make the proper diagnosis in order to help our patient. And if they need further evaluation, we can afford it to them, and we help them in any way with it. As again, always try to use the medication first, And if they need the procedure, we'll offer it to them and we'll help them with that.
Okay. One thing we didn't talk about, we talk about it now quickly, are pacemakers. Now that's something that's very common that we know.
Yes.
We all know someone who has a pacemaker. Tell us about that.
Okay, so usually pacemaker is a very common. You hear a lot of people has it, and the indication for pacemaker technically is a slow heartbeat. Okay, usually small heartbeat when the heart is not beating fast enough to make people do their own work. Remember, we started that the normal heartbeat between 60 to 100. So you need 60 heartbeat to do your major, your daily activity, activity. So, however, when you're sleeping a little bit, you don't need the heart as much. However, when people have this, they feel very tired when they have slow heartbeat. They're very weak, and sometimes most of the patients they come dizziness and sometimes passing out. And slow heartbeat could be permanent and could be occasional. And a lot of time we see it when the people have a long. One of the tests we didn't talk about called Holter monitoring was technically they're wearing an EKG monitor for 24 hours, and all of a sudden we see the heart doesn't beat for 2-3 seconds, 4 seconds, 5 seconds. Most people, when the heart doesn't beat for 5 seconds, they feel very dizzy, and most of the time they faint. So those people, we do offer them a pacemaker. A pacemaker is a simple device that we put it usually in the left upper shoulder, attached to, technically a battery attached to a wire, that the wire gets to the heart, inside the heart, and monitor. So whenever we set it, for example, if the heart go below 60, I want to make the heart beat faster than that. So that's what it is. So some people, they do come with no heartbeat. So that's their source of life. It's very simple procedure, take 2 hours to be done. And usually we keep them in the house with 1 day and to monitor to make sure that wire are stable in their position. And sometime now, if they come early, we let them go the same day. And it's a life-saving device, a treatment for this person who needs it. Unfortunately, people who require pacemaker, they need a pacemaker. There's no treatment that they can take at home to take it to make the heart go fast. Okay, so then when they come in and they need it, they will get it right away.
Yeah, I know the manager of the Yankees had a pacemaker implanted a month or two ago during spring training, and he's a young, active guy. So I guess, it's not just older people who need pacemakers, right?
Aaron Boone had it.
Yes.
I didn't hear it. I didn't know. Wow. I didn't hear. Wow. That's new.
Yeah, I taught you something new. Yeah.
I have a patient, actually. I do have a patient, depending on the way I implanted as young at 30 years old for people who needs it, and it changed their life. I remember one of the pacemakers I implanted when I became attending. A patient was having pauses while they're sleeping, and the sleep, they were having nightmare, and they didn't know why the nightmare come. We put a monitor. We saw that the heart, like for 5-6 seconds, the heart is not beating. So we put a pacemaker, and guess what? The nightmare disappeared. So person was waking up middle of the night thinking having nightmare, but technically he didn't have a heartbeat. I'm not saying every nightmare can be treated with a pacemaker, but certain people can get it. But I implanted even devices in younger patients. I remember one of the younger person I implanted was 20 years or 22 years old. But that wasn't a pacemaker, was a defibrillator. But some people do have need that. Unfortunately, some very young baby, when they're born with some not heart problem, they need to have a pacemaker as young as day one. So, which I don't deal with it, but it's a disease doesn't know age, Steve.
And a pacemaker can last how long typically?
Okay, so all the devices that we implant, it depends on the usage. Okay, so let's go to our example. People who only need the pacemaker, for example, because the heart stops 5 seconds a day. Okay, they only need it for 5 seconds. Okay, people who the heart doesn't beat at all, so they need it every beat. They need it 24/7. The technology that we have is very amazing. So most companies give you an average of 10 years for the battery to be changed, which is a very simple procedure. We came in, we take the old pacemaker, we put a new one in, within like half an hour, a person go home the same day. So on average, to answer your question, most devices last between 7 to 12 years. The average 9 years, they get it. And then technology is getting more better because they want to avoid changing devices. So the battery lasting around 10 years, 9 years. And again, depend how much the person use it. And it depends on how much energy need to beat the heart. Every person is different, but that's what we see.
Okay.
So on average, to be on the lower side, 7 years, to be on the higher side, 11 years, I would usually give 9 years. But that's the way. It's become part of their body. They don't know it's there, and they live with it, and they don't even know. And becoming very small now that people don't even know that they have it,
Yeah. My mother-in-law is 94 years old, and she just had a pacemaker put in the last year or so, and it's changed. She has a lot more energy than she had before. She seems a lot more with it cognitively as well. So it's really made a huge difference.
Yeah, because the heart wasn't beating fast enough. I see it right away. A lot of time, our patients, people who need a pacemaker, the older population, we're talking about they're in the 70s, 80s, they come in, they're very somnolent, they don't talk to us. The minute we give them the heartbeat during the procedure itself, they wakes up, I'll have a conversation during the procedure, where they're from, what they do, and this, you can see it right away because all what we did, we make sure the blood goes to the brain, and when the blood brain, they do feel a lot better. What the cause for them, like something is so hard, but we do see it right away.
Right. Okay. Well, Dr. Baghdadi, thank you for a few minutes today. I know you have to get back to work.
Yeah, I know. Thank you so much. I really appreciate the opportunity to talk to you. And I hope those people, they see this and come to our hospital to help them out. We do have a very good, supporting staff. We can get tests done here and we can help them every day. We open 24/7, as they say.
Okay, great. Thank you very much. And to our listeners, thank you for joining us at SBH Bronx Health Talk. For more information on services available at SBH Health System, visit www.sbhny.org. Until next time.